welcome to Hendo Health and Wellness. And this is For Example, sponsored by Hendo Health and Wellness. My name is Daryl Yates. I am the creator and founder of For Example. I am honored today to have this young man sitting on the side of me. We go back a little bit. We had so many discussions, and you will see once we get started, his wit and knowledge of just everything. No matter what subject we're in, he just knows a little bit of everything. His knowledge is just bountiful. And oftentimes I just sit and listen, and you will be captivated once everything gets started and we get to talking and discussing just life in general, especially about men's health, which is going to be our topic for today. Again, I'm honored to sit before and have you listen to this great gentleman. And I welcome you to listen to Dr. Daniel Whitehead.
Welcome. Thank you for that kind introduction. I hate to, they're going to be very disappointed when they hear this.
Don't start. You know what I tell everybody, because he was my primary care physician, I would tell everybody that every time I would go to see him, we would literally sit and talk for the first 20 or 30 minutes, just about everything under the sun before we get into the whole process of what I haven't been doing, because he would definitely make sure that I'm doing what I'm supposed to be doing. But again, welcome.
Thank you for the introduction. I was, I think I told you that the reason I think I feel so passionate about this is because of the fact that I did not choose medicine. Medicine chose me. I was minding my own business, and all of a sudden, out of the blue, I ended up applying to medical school and getting accepted. Ended up coming to St. Louis. I had an opportunity to go to Washington University Medical School. I graduated from there in 1980. I did my residency at St. Luke's Hospital. We're at People's Clinic at 5701 Delmar, which is the first job I had after finishing residency training.
Wow.
I was a medical director here at People's Clinic from 1983 to 1987. I then went to work at a staff model HMO. And I remember I left because I was so busy being medical director, I didn't have time to study for my internal medicine boards. And so I left because I needed to study for my boards. My plan was that eventually I was hoping that I would get to come back. And things happened. I got distracted by other things. I went to work. I worked for GHP for 10 years. And then after working for 10 years at GHP, I went to work for Mercy. And I worked at Mercy for 22 years. On August 20th August 7th of 2020, I retired from Mercy. And an opportunity came up for me to come back to People's Clinic, only not as an employee of St. Luke of People's, but as an employee of St. Luke's, where I did my residency. And I'm now teaching the residents and working with some of the same physicians who trained me, which is an incredible honor. But I get to work with them, helping the patients here at People's. And just a couple of weeks ago, I ran one of the patients I went to see. I introduced myself, and he goes, "No, I know who you are." You were here when I was here a long time ago.
Way.
So People's Clinic is a fascinating place. I think that one of the things that we tried to do when I was the medical director here, I left out the fact that I'm also on the board of directors of People's Clinic. And have been on the board of directors for a number of years. And I feel a very significant affiliation with this place.
Great.
That being said, one of the disadvantages of medicine now is that we rely so much on technology that we don't get to talk to patients anymore. And you aren't paid to talk to patients anymore. The financial model is not set up for that. So as a result, the way that I became comfortable taking care of patients was to learn about that person, and to learn as much about that person as possible through routine conversation. And unfortunately, that takes time, and that's not time that you are allotted to, or that you're given. They would rather have you check off a bunch of boxes, and I never had a sense that I really got to know a patient that way. When I got to know people real well, it allowed me to provide them with a treatment plan that I felt was tailored for them.
And I can definitely speak to you really sitting down and getting to know me in the beginning. I know at the time that Dr. Leslie Bond, rest in peace, who referred me to you. And the first few times we sat down, you just really listened to what I had to say. And at the time I was going through the trials, or I'm not gonna say trials and tribulation, but going through with my fiance at the time when she was going through cancer. And I just want to say publicly, I appreciate you for listening, because that was a very, very rough time. And you didn't say much, but you listened. You listened, and it meant a lot, because I didn't know which way to turn or which way to go as far as me actually going through depression, but didn't realize I was going through depression because I was in complete denial.
Mm-hmm.
Now, I would definitely say that when I try to go against the grain, because I don't like taking meds, I will say somebody in this room put on that daddy hat and check me pretty dang hard. And I was like, okay, he's gonna be all right with me, because normally I can get away with, no, I'm not gonna take no meds, and I'm not gonna say what you said, but we'll go, we'll leave that alone. But the point is that I just want to say I appreciate the fact that you took the time to just listen to who I was, and I just wasn't a patient. I just wasn't a number. With that being said, one of the things that I do is fitness. I do personal training. And one of the things I harp on everybody is getting themselves checked during their annual checkup. What can you help me with when I try to explain that to the men over a certain age, just say 35, 45, 50 years old? What can you help me say to them to get them to come in and get their annual checkups?
I try to impress upon them the importance of, it's best to, if there's a problem, that we find it early and not wait too late, not late before it becomes a problem. Our focus truly is in that direction. But patients have so many things that they've heard, that there's so much misinformation out there. And the misinformation didn't just start with COVID and the COVID vaccines. Misinformation has been going on for a really long time about all kinds of things. People are mistrustful of physicians. I remember going to the barbershop one time and somebody saying that, the reason why doctors write all those prescriptions is because they get a kickback for every prescription they write. And I don't go to that barbershop anymore because there was a bit of an uproar, because I said very loudly to the gentleman, "Go, damn, I must have missed that class in medical school."
I can't lie to you. I thought the same thing, so I'm not going to be here.
That nothing could be further from the truth. And in addition to that, what has been also somewhat troubling to me is the fact that I will go to seminars and they will talk about what's optimal medical care.
Mm-hmm.
And optimal medical care in many cases means more medication. And it's disturbing sometimes to see how much medicine they suggest. The problem, however, is that those medicines are expensive.
Mm-hmm.
And if you can come away with some way of being able to do that without those medications, then you can do that. For example, when I'm treating somebody for high blood pressure, for example, you walk in my office, your blood pressure is elevated. I do not give you blood pressure medication the first time I meet you. What I do is I tell them that I'm going to give you a diagnosis of elevated blood pressure. I'm not going to give you the disease hypertension. Because if I give you disease hypertension, I'm going to have to give you medication. But I'm going to give you 3 chances to get your pressure down on your own.
And what would those be?
Well, I'm going to have you exercise. I'm going to have you start watching your diet. You are going to eliminate the Lay's potato chips. Get rid of the salty foods. No fast foods. I mean, the things that taste good are salt and fat. Restaurants love to put salt and fat in the food because they want you to come back. Because they're not in the business of they make their money because you keep coming back. And if they load it up with salt and fat, you'll be back because it tastes good.
Yeah.
But that's not healthy. So what happens is, I have a series of rules that I developed that I wrote down, and I would give this to patients. Rule number 1, no fast food. Rule number 2, no snack foods, no Fritos, Cheetos, Doritos, etc. If it comes out of the vending machine, leave it alone. You want to be healthy, you want to snack on apples, oranges, and pears. Rule number 3, no sugared beverages. Get rid of the sodas. A big gulp at Quick Trip is not your friend.
I know a lot of people live and die by Pepsis and Coca-Cola.
They you drink Mountain Dew like there's no tomorrow.
I know a lot of people do that.
But that's not, that sugar high is not necessary, is not good for you. And so some people think they'll be healthy, they'll drink grape juice instead. Grape juice has got more sugar than Coca-Cola.
Try to explain that to folks.
Coca-Cola has 25 grams of sugar for an 8-ounce serving. Apple juice has 25 grams of sugar for an 8-ounce serving. Orange juice, 25 grams for 8-ounce serving. Cranberry juice, which is everybody just, cranberry juice is healthy. 35 grams of sugar for an 8-ounce serving. Grape juice, 43 grams of sugar for an 8-ounce serving.
Whew, that's a lot.
Yes, it is.
So
fruit juice is that's not the way to go. Now you could eat an orange, okay? You'll eat an orange and you probably are not going to have another orange. That orange will have 40 calories. But that 12-ounce glass of orange juice that's 120 calories. And you're probably not going to stop at 12 ounces. It's probably going more like 160 or 32 ounces. That's 320 calories. That orange was 40. And see, with the orange, there's all that extra, there's all the pulp that's in that orange, which doesn't pass through your stomach easily. So you become sated. You don't need to eat something else. You feel full. So because you feel full, you don't eat anything else. Whereas that glass of orange juice, once it's gone, you back go get something, get some more.
So to even emphasize that more, if you're not feeling well, you feel a little bit under the weather. So instead of going and buying some oranges, you just go eat some oranges, go eat some fresh fruit.
And keep track of what you're eating a day, But I mean, I said, when you eat lunch and dinner, make sure that half your plate is green.
Good point.
Okay. Those days having of candied yams and mac and cheese, them days is over. It's mac and cheese or candied yams, not both.
Are you sure about that? Dang.
Okay. And so, I mean, tonight when I have dinner, half my plate's going to be spinach.
Yeah, I think I'm going
to. The meat takes up a quarter of the plate, and the starch takes up a quarter of the plate. But half the plate is going to be green vegetables.
Make sure half your plate is green. That's the quote of the night.
Plan your meals. Sit down, figure out what it is that you plan to eat for the day. If you plan it out, then you're more likely to stay with it. You don't sit there and wait till noon, decide you want to get something to eat, because that's when you end up at McDonald's and your eyes will lie to you.
Yeah. Yeah, that's true. That is definitely true.
I remember once upon a time, my favorite meal at McDonald's, Big Mac, large fry apple pie, and a medium Coke. 1,500 calories.
Just from that.
Right there.
And the daily intake is what, 2,000?
Yes.
Well, yeah.
And the fat content is also pretty high at that 1,500 calories.
Yes.
I can now eat 1,800 calories, and I'm okay.
Yeah.
And as you can attest, I have lost a significant amount of weight.
I can definitely contest.
Because
I verify.
I started following my own advice.
That makes a difference. That makes a difference. Why do grown folks say they don't like water? I heard so many people say that.
Well, it doesn't have any flavor for them. They want something that has flavor. For me, it was the flavor. I miss the bubble. So I drink a lot of Perrier and a lot of Pellegrino and a lot of carbonated water, because I miss the bubbles. I don't necessarily miss sweet so much, and I've really gotten away from that.
Yeah. I will say one of the other things that oftentimes I express to a lot of my fraternity brothers, college friends, so many other folks, family members, is get your annual checkups.
Yes.
And what I mean by that is get your complete blood work. We're not getting any younger.
No.
We are.
Well, one of the things, the reason why the incidence of coronary artery disease in this country overall is dropping is because we pay a lot of attention to cholesterol levels now, which we never did before. Before, when you had your heart attack, the only treatment we did, we wait till you have your heart attack, and if you had it, and we tried to make sure that, we treated what was left after you had your heart attack. That progressed to the point where what they were doing is trying to make the size of your heart attack smaller, so they would cap you and maybe dissolve the clot that was causing the problem. And then they eventually got so low, how can we prevent people from having heart attacks in the first place? And that's when they started paying attention to cholesterol numbers. And cholesterol is something that you can't know. I mean, you can't know what your cholesterol is without getting it checked. And I'm always stunned, shocked, and surprised at how you cannot predict that. Although if you take a family history, and the only way that's going to happen is you go to the doctor, you can find out who some of these people are, because some people just have, they chose their parents poorly.
That's a whole nother issue right there.
So I mean, you could be like, I can think of one gentleman that came to see me once upon a time, who his mother had sent him in for a physical. And we had a long discussion about that. And his name sounded familiar, because it was an unusual last name. And I said, "Is your father so-and-so?" And like, because I remember this, I had this other gentleman that had that name. Oh yeah, that's my dad. Well, tell him I said hello. He goes, "Well, I would, but he passed away last week. That's why I'm in here, because my mother made me come in." Now, I had not seen his father in quite some time. And I remember his father having a very low, we call HDL cholesterol. His father was not big on coming to the doctor, and that was why I had not seen him again. And this young man was 19 years old. And when I checked his HDL cholesterol was dangerously low. And so he's going to spend the rest of his life taking cholesterol medication and really watching his diet, because, as we say, he chose his parents poorly. I mean, because it runs in his family. His father died at a rather young age because of coronary artery disease. And if he didn't take care of himself, he was too.
So what do you mean by, for the folks who are not fully clear on the HDL, and what are the things you look for if you say go get an annual checkup? What does that entail?
Well, what they'll do is they will check a cholesterol level. They will check the HDL, the LDL, and your total cholesterol, and your triglycerides. That's the amount of fat that's in your bloodstream. And it's done as a fasting test, because if you eat, then your triglycerides will be artificially elevated.
Correct.
So we want to know what that number looks like. That's one of the tests that we're going that would be done. And what happens is once we get that result, we can, it used to be just looked at the cholesterol HDL ratio. We don't do that anymore because that's not as reliable. Now we've got there's a program that you plug into the computer, and it gives you a percentage of what is your 5-year, what is your risk of having a heart attack in the next 5 years or 10 years. And if that percentage is over 5%, then you probably need to do something about that. And in that case, giving you medication is the way to go.
So how would I ask for when
You don't have
come in?
that. You come for a physical, the doctor should
do
he's
that?
going to do that.
Okay. And what is the return on getting those results back?
48 hours. Because what's also going to happen, he's also going to check he's going to check your serum glucose, find out where that is. If your serum glucose is elevated, that means you either have glucose intolerance, which is on your way to diabetes, or you might actually be diabetic. And that's a whole nother set of issues that we deal with. And that's something that we'd like to be able to do something about. In that case, again, diet is paramount. If you look like you belong to one of my family reunions, you're in trouble. Because the fact is, we will calculate your body mass index. The body mass index is a calculation based on your height and your weight. If your body mass index is greater than 30, you're at significant risk of having diabetes. If it's greater than 35, you are diabetic waiting to happen. It's only a matter of time. It's not an if, it's a when.
So here's what I always found, I'm not gonna say troublesome, but it was something I really understand. So my BMI, I'm supposed to be 180 at 5'11" and a half. I'm supposed to be 180. I haven't been 180 since the 8th grade.
No. I see that some of those calculations were off. And again, when you look at the medical literature, they qualify you being obese if your body mass index is greater than 25. Okay. I don't pay attention to that. It's not that I'm trying to be realistic. And the fact is that what I'm trying to do is I just want you to get below 30. And I damn sure want you below 35.
Okay. Anything over 35, there's a problem.
Yeah, if they through 35, there's a significant problem. It's not a question of if, it's a question of when. So you walk in my office with a body mass index of 50. Ooh, oh yeah.
Yeah, that's a lot.
And you walk in and that person frequently will like, no.
What are some of the telltale signs just physically, if I were to walk into your office and you know that I'm overweight just by appearance alone, are there other telltale signs?
No, see, that's the problem. There's aren't going to be any until it's too late.
I thought the one of the myths, barbershop myths, like if you start getting the dark spots up under the cheek and the chin,
there's a sign associated with diabetes when people develop some hyper pigmentation, and they'll develop a rash that's around their neck. That's in patients who have diabetes, but that's not necessarily associated with you having an elevated body mass index.
Or beginning stage of diabetes by having those dark.
No.
Okay.
No. The only way you can tell is get a blood test.
Okay. So
in addition to getting the blood test, I'm also going to check if you're over 40, and you're over 40 and you're Black, I got to get a PSA.
That's, you just that's why we right there, because you just led right into my big question of the night.
I'm going to get a PSA because I need
what
a
exactly
baseline.
The PSA?
PSA is a prosthetic specific antigen. It's a test that was developed here in St. Louis at Washington University by Dr. Catalona.
You tell me that, yes.
Dr. Catalona developed this test because he was hoping that we wouldn't have to do rectal exams anymore. Patients didn't like having them and doctors didn't like doing them.
I'm gonna leave that one alone too.
Unfortunately, the test is not as good as we had hoped. It's better than the test that we used to do. It's just called acid phosphatase. It's better than that test.
What is that?
That was another blood test.
Okay.
The problem with that was that if I already did it directly, if I do a rectal exam on you,
So glad you mentioned that. What are you checking for when you do that?
I'm trying to see if there's any masses in your prostate. Because if there's a lump on your prostate, then that's a problem.
Okay.
The problem though.
But that's when you pop the glove with the jelly.
Yeah, you go up there.
Okay, gotcha.
Yes.
Just want to make sure
Yes.
for everybody who hasn't had that.
The problem with that exam, however, is the fact that I can't feel your entire prostate. And even though I have really long fingers, okay, I can't get around to the back of the prostate.
Yes.
So if I feel a lump, it's probably a significant problem, but you could have one that's growing out beyond my reach.
Okay.
Which is why we also do the PSA test. PSA greater than 40, than 4 rather, PSA greater than 4 increases the likelihood that you've got a problem. You could conceivably increase the likelihood that you have prostate cancer. Doesn't mean you have prostate cancer, just increase the likelihood. Because I've seen patients with PSAs of 14 and 15 who didn't have prostate cancer.
Wow.
And that's why, that's unusual, but it is possible. And that, like medicine, unfortunately, it's not a black and white issue. I mean, it's not sort of like it's definitively this is this is it. Invariably, what has to happen is a biopsy has to be done.
And please don't forget that point. But I wanted to make sure that people who are listening, I want you to understand is that this transcends all races. It's not just a black issue.
No,
not just a white.
It just happens
one of those
issues. Black people are more likely to get prostate cancer.
Correct.
Okay. But white folks get,
there
are a lot of white folks who get prostate cancer.
So everybody that's listening, please get yourself checked.
Actually, I have a story about that. I have a story about everything. Yes. This one is a gentleman who was, he was Caucasian. He was a patient of mine. He was actually the father of one of my medical assistants. And he came in and his PSA was normal. Because his PSA was normal, he said he didn't need a rectal exam. I told him that I wanted to do a rectal exam, and he told me point blank he wasn't having it. And the conversation got loud because he was adamant that he was not going to have a rectal exam. He's on his way out the door, and we opened his door. The daughter is standing on the other side of the door, and she told him in no person, "Yeah, he is." If you knew his daughter, you would know that she was somebody who just did not take no for an answer. He actually backed down. When I did his rectal exam, I found a lump. I was surprised because his PSA was less than 4. Wow. His PSA was like 2.8 or 2.9. He should not have had a problem based on, I said, what's the likelihood that you have a problem? Okay. So it was not something I expected to find. What was really sad about that situation, though, not only did he have prostate cancer, but he had a really aggressive prostate cancer. And this actually eventually would cause his demise. Because it was a rather rapid growing, and prostate cancer for the most part are not rapid growing tumors. They grow rather slowly. This gentleman had a very fast growing prostate tumor. And caused his demise.
And thank God that she insisted that he go in there and
get
it.
Because,
wow. I
see there, and there's all kinds of confusion because then there's, well, how do you treat it? Okay. And there's treatment, there's radioactive seeds that can be implanted. There's radiation therapy, and they can be very specific with where they do when they do the radiation, where they're doing their radiation, and there's surgery. And each one has a set of side effects that can be significant. And I would just tell patients that when you go, if you're being evaluated, talk to the urologist. And talk to them in great detail and ask questions, that you know what it is you want to do.
Does it have a significant, if prior to your PSAs, would you have a significant decrease in urine flow when it is becoming a problem?
No, because actually that usually causes a separate problem called benign prostatic hypertrophy. And that's where the prostate swells. And when the prostate swells, the urethra, which is the tube that leads from the bladder out, actually goes through the prostate. And that benign prostatic hypertrophy is what's causing that problem.
Mm.
And that's not necessarily caused by a prostate cancer. So the symptoms that people frequently have, urinating, is usually caused by benign prostatic hypertrophy, usually.
That just went over my head.
And benign prostate, that's just a swelling of the prostate.
Okay.
And benign prostatic hypertrophy can cause an elevation in your PSA.
So until you actually get a good get your blood checked or blood work, you don't know a lot of what's going on until you get that annual check.
No, you don't. So you're going to get a PSA, you're going to get a complete blood count. You want to find out whether or not you're anemic or not.
Would that make a difference on the PSA?
No.
Elevate? Okay.
No, that's a whole separate issue, because then sort of like if you're anemic and you're a man, then that makes me believe that why are you anemic? You shouldn't be. If you're female, you might be having heavy menstrual periods. But if you're a guy, what's going on? You shouldn't be losing blood. There's no reason for that. So if you're losing blood, well, I'm going to ask why, which leads us to our next thing that you need to look at. That's the colonoscopy.
Explain that.
Colonoscopy is a test where we take this tube and go up your rectum and go up and have a look at your colon. Years ago, we used to do what's called a proctoscopic exam, and it was a rigid scope that was like about yay long. And we got very good at being able to find cancers that were in the last part of the colon. But as things happen, people start having colon cancers in their distal, a lot farther away than you could reach with that. And eventually we got so that there was no point in doing the proctoscopic exam, because one, it was an extremely unpleasant procedure. And secondly, we weren't helping anybody. Now we do a full colonoscopy, send you to the gastroenterologist, he does that test the first time at age 45. It used to be age 50, now it's age 45.
You went right into my next question. Go ahead.
So at age 45, we do the colonoscopy.
Would there be a reason to do it earlier than that, like family history?
If you have a family history of colon cancer, yes.
Okay.
Because if you have a family history of colon cancer, it means we do need to be more observant and look very aggressively for that. There's certain things, or inherited diseases that people have, that, so again, it's important to find out your family history. If you are like my family, my parents didn't talk about their diseases. Okay, if you ask me what, only reason why I know is because I'm a physician and I badgered people to find out what people died of. But many of them, they didn't, I mean, my grandmother passed away at age 65 with complicated diabetes. She had a stroke. My grandfather, my mother's father, also experienced something very similar. But it's only because I investigated that I found out, because they weren't telling me nothing.
And why is that?
We just don't. We just don't.
I mean,
people, not only that, but people of that generation tended not that they didn't talk about those things.
Yeah.
And I will run into patients who, like I've had patients who tell me, well, it ain't bother me, I'm not gonna bother it. That's just something, they just not gonna deal with that.
I know that my grandfather, who was a towering figure, and as a kid, I thought he was Superman with hands about the size of this table, so to speak. Again, I'm 5 or 6, looking at this 6'2", 6'3", big man. And I know he had some issues with cancer. And I think, if I remember correctly, that was his ultimate demise, but he never went to the doctor. I mean, he never even had his teeth. He had to get his, he was forced to get his teeth pulled because he never really went to the dentist, but it was causing so many problems.
Yeah.
But even on my mom's side, just the vast majority of my uncles end up being on kidney dialysis, had to have dialysis 2 or 3 times a week. And it's like I made a conscientious effort to make some improvements on the way I eat. And that's why I'm in the fitness field that I'm in. But I always try to remind folks it's like the same things we were eating in the 70s and 80s. It's not the same nowadays. We can't eat the same stuff and expect the same results like our grandparents.
Well, one of the things I find actually rather comical is the fact that my grandfather, my father's father, he grew his own food.
My grandparents did too. My grandfather did too.
He grew his own food. My grandmother did not go to the grocery store for vegetables. She went outside and picked.
Yes. Yes.
Because my grandfather had this garden that was the size of a tennis court that he plowed by hand.
It was fun. That's about the size of, it was right in back of our single wide trailer. And that was like my summer thing to do, but I enjoyed it. We had, and plus we had no lawnmowers. We had the old sickle.
No.
We had the little push thing, and then had our corn, potatoes, and we had an apple tree, a pear tree, and something else. But we had so many, I mean, we ate for days.
I mean, that was, you went outside and
Yes, make a world of difference.
There are no pesticides. It was truly organic because there wasn't no pesticides.
Correct.
Okay. And tomatoes, they didn't taste like those ones you get at a grocery store.
You're correct. Okay. Absolutely.
So, I mean, one of the problems we have is the fact that, we are forced to, we don't eat well. We got in the habit of going to fast food restaurants because they were convenient.
Being lazy.
Well, there's no grocery stores in our neighborhoods a lot of times.
Yeah, food deserts. Yeah.
Okay, so that's a whole nother issue.
Yeah, that's true too.
So the combination of that make, there are more. Dr. James Galvin, who's one of the Dr. James Gavin, who is a superb endocrinologist, first Black man to finish the endocrinology program at Washington University. He was a fellow when I was a medical student a long time ago. And he's a giant in the treatment of diabetes. And during a lecture, I heard him say, and this is a quote, "The incidence of diabetes in this country per zip code is directly proportional to the number of fast food outlets within that zip code."
Yeah.
I mean, you drive down you go up Kings Highway, you'll go to Delmar and make a left. You will find lots of fast food outlets.
I agree.
Ain't no grocery stores up there.
None whatsoever. I think I went down, I went down Natural Bridge and I made a left on Grand, not Grand, but I made a left on Union. And from Union all the way to Forest Park at that time, which was a few years ago, it was like 28 different fast foods, give or take. And for when it was fast food, check cashing, and all these other different things. I mean, it was a lot of liquor stores. It was like 28 just in that maybe 2 mile, 3 mile radius. And it's unfortunate. It's definitely unfortunate. Well, I would definitely say where I know your time is valuable and I don't want it, because I can sit here and talk to you for hours at a time, and I'm always going to learn something new. You always have some gems for me to take home. I would love for the people that are listening, if you have any questions, please ask them, and I would love to take up maybe 30 minutes of your time.
Okay.
Again,
there's one thing that I would like to say, just in closing. We've talked specifically about high blood pressure.
Yes.
High blood pressure is the hardest disease that I treat. The reason why it's the hardest disease I treat is because I can't make you feel better. You don't feel bad in the first place. Somebody walk into the office, they have blood pressure 170 over 110, they feel perfectly fine.
What should it be?
120 over 80.
Okay.
And the reason why and the thing is, like I said before, you walk in my office first time, your blood sugar is elevated, I give you an opportunity to get it down by diet and exercise. And you come back a couple weeks later, we recheck it. If your blood pressure has come down, well, then I'm going to hold off. If it's still way up, I'm still going to hold off because I'm going to give you a third opportunity. After three times, I'm going to give you medication. The thing I need for the patient to understand is once I start you on medication, you're not coming off. High blood pressure does not go away. You'll be on this until the undertaker has you. When you are no longer, when you no longer can take medication, that's when you stop. You know, when I tell you that you stop, or when you no longer breathe, that's when you stop taking your blood pressure medicine. It is not a disease that's going to go away. Multiple patients will ask me, well, I know somebody who stopped taking their blood pressure, they were fine. I know a bunch of people that stopped taking their medication and then they were fine initially. But that's not, the fact is, you can't tell. There are no reliable symptoms for you to have an elevated blood pressure. So they tell me that, well, they have a headache. How many people, if it was a reliable symptom, we wouldn't be misdiagnosed. There wouldn't be 50% of the people who have high blood pressure that's untreated would not be untreated because they would know the pressure is elevated.
That's a good point. That's a good point.
Okay.
Wow.
And so if you need the medication, and the thing is, it's so much better now than it used to be. When I worked at People's Clinic, the drug that we used was a drug called Aldimet. I wouldn't give that to my dog my worst enemy on a good day. Because if I give you Aldimet, you're not gonna have an erection again in this century.
That's a whole nother discussion.
Okay.
Too.
So the newer medications don't do that. While there may be initial problem because the pressure, because your body's gotten used to that pressure, the medicine itself isn't what causes cause erectile dysfunction. With Aldimet, it definitely was. Okay, with Aldimet, it definitely was. Aldimet caused erectile dysfunction. But the newer medicines is less likely to be a problem. And what I always try to do is give you multiple medications at a really, really low dose. I give you low doses of 2 or 3 different medications, I could avoid the side effects, but still get your pressure down because I was attacking it from a different size. Okay. And my hope was I could get your pressure down without you having problems.
And by having high blood pressure, it does affect everything.
Well, because if you stroke, heart attack, and kidney failure, if I don't treat it, that's what you're going to be faced with. And you can't wait until you're about to have your stroke because we don't know when that's going to be. Of course, when you have it,
there's no recovery.
I can have one of the finest neurologists in the world walk in the room and go, yep, you had a stroke. But we can't regrow brain cells.
And once you have it,
once you've had your heart attack, that's it. Once your kidneys have failed, that's it. Off the dialysis you go. Whew.
Oh, that's
so the trick is to treat it now before it becomes a problem.
That's you can't get any plainer than that. And I don't have a response to that. I mean, if you don't treat it now, then you will suffer the consequences.
Yes, you will.
Not a matter of
it's not a question if, it's a question of when. Now, if you have side effects, you call your doctor. You call your doctor. And we change your medicine. We don't own stock in the drug companies. That's another myth that, like.
Yeah, I wasn't gonna say that. I'm gonna leave that alone.
So, we don't own stock in the drug companies. So we will change the medication, we'll change to something else. There are multiple medications out there that will lower your blood pressure. So we change it to something else. What we don't want you to do is be one of the people who's 120 over 80, or excuse me, 180 over 120, because then I have to use medicines that have side effects, but I don't care because I've got to get your pressure down.
Wow. you can't recover from a stroke.
No,
Once your kidneys are gone, your
No.
heart, all that's, once it happens, that's it.
yes.
So with that being said, Dr. Whitehead, again, I duly appreciate you taking the time to speak, but it was needed. It's needed because I can say it, but when it comes from a doctor that looks like a lot of us who watch the discussions that I normally have, it hits home a lot more. So again, I appreciate you allowing me to take up some of your time. Again, I'm gonna keep in contact, and if I have questions, I probably will beg my way to get you to give me 30 more minutes. But I can't stress the importance of, we got to get our health back in order, do some form of exercise, drink some water, get your annual checkups.
One other thing, and I'm sorry, I don't mean.
No, you're good.
One
You're
other,
good.
people also have to learn how to use the system. Now, the systems are changing
Mhm.
as we speak. There's a bunch of urgent cares around here. Everybody walks around with this. Okay. This is a very useful tool, and we don't take advantage of it.
Mhm.
Okay. Everybody should be writing down the medications, and the
Good point.
medications should be in here. Every time you go to the doctor, you write down a little bit of what's in here, because if you go to urgent care and then you go to the hospital, or you go, if you don't have a primary care physician, a lot of people don't even have primary care physician anymore. I think that's the best way to go. That's only because I was a primary care physician, and I think that's the easiest way to go.
Mhm.
But a lot of people don't do that. They go to urgent care. But when you leave urgent care, that information is over there.
Mm.
If you go to the hospital, that information is
Go
not
look,
necessarily
yeah.
going to the hospital.
Yeah.
So you need to put that information in here. So when you get to the hospital, you can show them what happened. I can't begin to tell you how many people show up and go, I went to urgent care. Where? Why? What happened? And because the person is not medically sophisticated, they can't tell me in a way that helps me understand their problem.
Good point. Damn good point. Because I found myself, even back in my day when I was starting to make that transition, I was taking some medication, but the doctor would ask me, I didn't have no clue what I was taking because I couldn't remember it.
Well, I had an episode where I went to the hospital, and as a board certified internist, I mean, like, I know what medicines are, but because I was upset about the fact about why I was in the emergency room, the first turned out it was nothing, but
Mhm.
at the time I did not know it was nothing. But it took me having to tell the guy come back 4 or 5 times where I could get out all the medicines I was on, but I could remember them all. Now they're all in here.
All you gotta do is go click. That's
There
it.
it is.
That's it. It makes a world of difference. And that's just beautiful advice. So anybody's going to the doctor, please write down your information, get your annual checkups, and please understand that this conversation, this won't be the only one, because we have to get ourselves back in order, get our exercise back on point, and just realizing that life is too short. And we need to take advantage of the opportunities to just enjoy life, but enjoy your life health. With that being said, until next time, this is, for example, Daryl Yates is here. If you have any questions, please give me a call. And again, Dr. Whitehead, I truly thank you. I really appreciate it.
Thank you.
Until next time.